Alright, so we are back on WordOut channel again. This is Emayaka. Here with Dr. Kaufman. Dr. Kaufman, welcome. So right now we are going to focus on signs and symptoms. So we need to find out how we can identify signs and symptoms from people who are having COVID-19.
So many people experience COVID-19 differently.
Okay.
But when we look at all people who have COVID-19, there are three symptoms that most people have in common. That would be cough, fever, and difficulty breathing. People may have other things in addition to that. People may not have all three symptoms. But usually they will have some of those symptoms if they have the disease. So for example, if somebody only has diarrhea, it's probably not COVID-19. But if they have cough and a fever, one might think it probably is at risk for COVID-19.
Okay, so you're talking about the main signs that is being approved by CDC. That is, you said cough, fever, and
Difficulty
breathing. Is there any other additional signs on that?
So there may be other things, okay? We're not sure yet. We're still learning about this infection.
Okay.
Some people say that if a person loses their sense of taste and smell, suddenly they can't taste things, it might be COVID, but we're not sure yet. Okay? Certainly if they get fever and cough with that, I would be worried. If that's all they have, maybe not.
Okay. These signs looks like a similar signs for other medical problems. How can we differentiate? It might not be COVID-19, but somebody's having similar signs and symptoms. How can we differentiate that?
So that's a very difficult thing even for doctors right now.
Okay.
One thing that is on our side is the time of year. Because influenza, the flu season is already over. So we don't expect the flu to be going around in our communities now, which has similar symptoms. Cough, fever, pneumonia. Sometimes if it's bad, you can get shortness of breath. Most other things occurring this time of the year don't have very strong symptoms. Okay? Like non-COVID-19 coronaviruses and other types of viruses. But this tends to be progressive. This tends to get worse over several days. It is important to recognize that the first 5 or 7 days, a person may not be aware they're sick. And then starting then, they will begin to get sicker and more sick. But they've been able to spread the infection for the entire 5 to 7 days when they didn't know they were sick.
Oh. Wow. Do you think people are forgetting about other diseases? They are just focusing on COVID-19?
So, I think that decision is for the doctors to make.
Okay.
Okay? So, it's important that if somebody is concerned, they call their physician, they call their healthcare practitioner, and say, this is what I'm experiencing. Sometimes a trained medical expert will say, I don't think so. And sometimes they'll say, I want you to go to the hospital. I struggle with this myself, as do the infectious disease experts. But we have the experience to make a better decision than people in the community. We've been doing this for many years and went to medical school. So let us take responsibility for that. Please, make a phone call if you're not sure. Better to be safe than to expose many people and be in the hospital if we can help you.
Thank you very much. So stay in touch with Dr. Kaufman. We are talking much about signs and symptoms, and it's really interesting. It's a conversational program, and we are looking forward to break the information into pieces for everyone to understand on ground. Thank you very much, Dr. Kaufman. We are coming back with another episode. We are back.